Everyone. I know we've got some folks that are trickling in now, and we're going to get started here momentarily. If you are here for the underwater basket weaving session, that actually starts next hour, but looking forward to that one as well. No, this is turning 65 and what you need to know about Medicare. And so we're going to cover off on all of those things. I know everybody's been waiting for Tuesday, July the 14th at noon Central to talk about all of these things. And so as we get started, a couple of housekeeping items that I always like to mention. Yes, we are recording this session. Yes, you will get a replay of it. You can either share that with friends, family members, things along those lines, or rewatch it if there are questions that come up. One other thing is there's a Q&A and a chat functionality that you can utilize. Those are down in the bottom portion of your Zoom window. If you're watching on mobile, it might be under a menu, but those are there. So feel free. One thing I love to do is to utilize that chat functionality, ask any questions that you might have about Medicare. I guess about me too, if you want to know more, but we'll share a little bit there. And we're going to get started here in just a moment, but feel free to use that chat functionality. Josie, our Director of Marketing and Community, is on this call as well and is going to be there to answer questions that she can handle or to feed those over to me. I'd love to know where you all are watching from today. Josie actually just asked that question there in the chat. Feel free to let us know. Would love to know where you're tuning in from. I'm in Evansville, Indiana, so Southwest Indiana. I could throw a rock from my office and I could hit Kentucky, and I could throw it a lot harder west and hit Illinois. But we're just tucked down in Indiana, and so if anybody's familiar with Evansville, that's great. So we've got a couple that are there: Prescott, Arizona, Bastrop, Texas. I probably butchered the way of saying that locally. I see a Goshen, Indiana. There's a fellow Hoosier. So glad to be on a call with a fellow Hoosier. We got Pinehurst, North Carolina. Save me a tea time. That'll be great. Atlantic City, New Jersey, right on the beach. Andrew, good to hear from you and see you again. So we're going to get started without further ado. I'm going to share my screen. We'll kick things off. And so here we go. So here we are. We're going to turning 65 and what you need to know about Medicare. And today is July the 14th at 12 p.m. And so we're going to get kicked off here. And so first and foremost, a couple things you need to know about us at Move Health. Who are we? Well, we have lots of experience in the health insurance and Medicare space. We're SOC 2 Type 2 certified, which just means that your data is secure with us. That's an extra framework that we go through. We're also HIPAA certified, which is in addition to that, just a security framework to make certain all of our client data stays safe and stays only with us and you. We can provide both pre-65 health insurance guidance, so we're not just Medicare, but we certainly help with that often. And so we can do pre-65 as well as Medicare. We can also help with things that round out coverage like dental and vision. And we're a Wealthy Award-winning platform. A Wealthy Award, for those that don't know and aren't in the wealth management space, is a wealth management specific tech award. And we're also the largest and fastest growing healthcare planning solution that's utilized by financial advisors and their clients. And so many of you may have come to us through a financial advisor or a friend that may have circulated this link to you. Regardless, we're glad that you are here. Maybe you're a financial advisor yourself and you're understanding a little more about what we do and how we work alongside you and your clients to improve not only healthcare plan outcomes, but financial planning outcomes as well. And so without further ado, I'll share a little bit about myself. More importantly than my role as the co-founder and head of growth here at Move Health, I'm a husband first and I'm a dad. And those are two of my very favorite jobs. They are my favorite jobs. Second to that is, my work here at Move Health. And third to that, I'm a musician. Have done that professionally in a past life. And an old house renovator. We live in a 1917 Tudor revival house. If you all are familiar with architecture. And so that is a picture there on the bottom left of our kitchen about this time last year. And thankfully, it doesn't look like that anymore. Or else I think my wife may have not been my wife any longer. But we just did a full renovation of the house, and it's been a lot of fun. And so that's a little bit about me, so you know that I'm not just some talking head in a little bubble in the corner. And so glad to be here with you all. And so we're going to talk about some Medicare related things. And so Kevin's already got a question in there that we're going to answer a little bit later, but keep those questions coming. Those are super, super helpful and gives us some things to talk about along the way. So we've got some things to cover off on, and we're going to move forward. So Key learning number one, we're going to learn about the basics. So there's a lot of things that you hear about Medicare. Maybe I joke about, you hear about it at pickleball, you hear about it online, you hear about it in forums, and some of that information is, I think well intentioned, but in many cases can be misleading or incorrect depending on the source that it's coming from. And so we're going to start with the basics to make certain that everybody on this call has a clear understanding of what Medicare is, what it isn't, how it works, what it does do, what it doesn't do, all of those things. And so Medicare basics, what are those? Well, when you get to Medicare and turning 65 specifically, which is how we're going to frame the conversation today, there's traditional Medicare and there's Medicare Advantage, and there's kind of this fork in the road. And so the question that was in the chat is relevant to this. If you choose a Medicare supplement, can you not switch to another supplement without underwriting, et cetera? We're going to talk about that in depth, Kevin. I'm looking forward to covering off on that with you. A Medicare supplement kind of lives over on this side of the road. And then you've got Medicare Advantage over here that lives on the right side of the road. And so neither of these are the right or wrong answer. Rather, they are solutions to solving for Medicare coverage. And so we're going to go in depth on each of these. And as we think about turning 65, you have this fork in the road, and it's our job to help guide you through a decision point. And so understanding original Medicare, this is parts A and B. So if you remember, Medicare has parts, right? So parts A and B, Alpha and Bravo, are also known as original or traditional Medicare. So as we think about and you hear me reference original or traditional Medicare, it's important to note that I'm referencing parts A and B, Alpha and Bravo. So part A, what is part A? Well, this is going to cover the hospital portion of your medical needs. And so the way that I reference part A, and I actually took this from one of our team members, is that it is the Jell-O that you are eating, the nurse that brought it to you, and the bed that you are laying and eating it, right? So the hospitalization portion, this is inpatient hospital, skilled nursing, home health, and hospice, right? Generally, Medicare Part A is premium free. You've paid for this portion your entire career. So long as you've worked your 40 quarters, which I'm from Indiana, Southern Indiana specifically, so my math isn't great, but 40 quarters is about 10 years. If you or a spouse have worked 40 quarters, you can draw Medicare Part A premium free. So for most folks, it's generally $0. There is a very small portion of people that would pay for Medicare Part A, but that's a rare component. And it's generally $0, has a deductible of $1,736 for 2026, and that's per benefit period. We're going to talk about why this number we don't really need to concern ourselves with this figure, but per benefit period means that it begins when you're admitted to the hospital and ends when you haven't received any inpatient care for 60 consecutive days. So a good way to think about this is, if you are on Part A only or Part A and B only without Medicare Supplement or Advantage plans, you'd pay $1,736, and that's the Part A deductible. Then, if you went back into the hospital 61 days later after discharge, you'd pay it again. So you could potentially, again, I'm thinking about this, in the terms of Evansville math, but you could potentially see this deductible hit 5 times in a year, right? If everything lined up and timed out perfectly. But it's a per benefit period. So that's an interesting component of Part A. It's 100% approved for home health, hospice, and days 1 through 20 in a skilled nursing facility. It's important to note that Medicare alone is not a solution for long-term care planning. So long-term care insurance, long-term care planning, those are all components that are a part of Medicare, but don't plan on Medicare being your solution for healthcare when you may need a nursing home, things along those lines. So that's Part A, Part Alpha, hospital. Part B is in Bravo. This is the medical portion. This is kind of the everything else bucket. And so this is going to be your doctors, outpatient care, labs, tests, things along those lines. Part B is in Bravo is also the portion that you pay for. So if you are someone who's transitioning to Medicare in 2026, your premium for Part B is going to start at $202.90. Now, that can also be impacted by IRMA, which we'll talk about IRMA here in just a little while. And it has a deductible as well. So Part A has that deductible of $1,736 per benefit period. Part B has a deductible of $283, and that's for the year. So there are some confusing components, but we're going to talk about why we work to simplify that quite a bit. After the deductible is met, Medicare is generally going to pay 80%, and you have no maximum out of pocket. Client pays 20% with no annual cap. So maximum out of pocket, I joke often, is a reassuring statement until you realize that it's your pocket they're talking about, right? And so Part B, the medical portion, it's going to cover 80% of costs. 20% you will be responsible for with no annual cap. And so this is why we put this big disclaimer here. Part A and B only cover 80% of costs. And so, as an example, I had a knee surgery last fall, and I'll eventually stop referencing this as my example, but it still feels recent enough to be useful. But I had a knee surgery. It was outpatient. I was in and out of the hospital within the same day. It was a total knee. Not replacement, but rebuild essentially. They did ACL, MCL, meniscus, a couple of things like that. Big deal. And there's some screws in there and some other things. And with that, if I had Medicare Part A and B, which I don't, but if I did and went in to have that surgery billed my insurance company over $100,000. So if we use $100,000 as our rough number, and I was on Medicare Parts A and B only, you can put it in the chat there what my responsibility would have been, but it would have been $20,000 if I only had original Medicare Parts A and B, because it's going to cover 80% of the costs, but it's not going to cover all of them. And that $20,000 is uncapped. So if that was a $200,000 surgery, or if I had a hospital stay that followed it and it totaled 200 grand, I'd be on the hook for $40,000. And that's just what it is. And so that's why we always recommend that there is something to supplement, if you will, or fill that gap, right? That Part A and B leave, because Part A and B are not going to cover everything. And so that's important to note. If there are any questions about original Medicare, feel free to put them into the chat. I mentioned in a reference to Part B, IRMAA, IRMAA. This is the income-related monthly adjusted amount. And I joke and say often that it's the you did well for yourself tax. And this is Uncle Sam saying, hey, you're going to pay a little more for your Medicare Part B as in Bravo and Part D as in drug, which we haven't covered yet, premiums. And the funny thing about IRMAA is that it's based upon your income from 2 years ago. It's determined by the Social Security Administration, and it can be appealed in particular situations, which I'll talk about here in a moment. But Medicare Part B and Part D, you might pay a little bit more for if your income is above your tax filing status and income is above certain thresholds. So if we look here, and I'll just kind of look at this middle column in the light blue section that says 2024 annual income for married filing jointly. Many of the folks we work with are married filing jointly or in that individual status. So if we use married filing jointly, if your income from 2 years ago, so if you're transitioning to Medicare in 2026, if your income in 2024 was $218,000 or less, your Part B premium will be the standard Part B premium. So if you're anywhere under $220,000 married filing jointly, you pay less. Now, if you watch as income goes up in these different brackets that kind of mirror, if you know, tax brackets, you can see your premium for Part B goes up. And this is the inclusive number, so it's 202.90, and then it's 284.10, and then if you're, let's say we were a $300,000 household, we're going to pay 405.80, and then you can also see that there's a surcharge that's added to the premium of your Part D prescription drug plan. And those will go away as you go into years where your income has gone down, right? So if you had a big year 2 years ago and your income is going down, in 2026, you may pay more for your Medicare, but in 2027, you'll be reassessed. This is assessed every year, and you'll be reassessed and your premium will go down. Now, if you're someone who's retiring and you had a big year in 2024 and they're saying, hey, you need to pay the top tier of IRMAA, you're going to be paying almost $700 for your Medicare premium. You can say, wait. This year, when I'm retiring, I am going to be receiving significantly less income. And so you can take that as an opportunity to appeal that IRMAA. And that's something that we at Move Health can help you to flag. We can't do the form for you, but we can help to flag whether it's something that will be approved or not. IRMA is, IRMA appeals, I should say, are looked at by a human being at the Social Security Administration. So we don't have a silver bullet for what gets it removed, but sometimes you can even reduce, right? So if your income was up here and you're going down, you can reduce your Medicare Part B and Part D premiums significantly just by going down in tiers. Even if you can't remove it altogether and bring yourself down to standard, sometimes you can reduce it, and that's worthy. So a lot of times in our work with financial advisors and their clients, we're talking about IRMA, the income related monthly adjusted amount. And when I talk about IRMA, I may mention it later. I'm not talking about the hurricane, and I'm not talking about your auntie. I'm talking about the income related monthly adjusted amount. And so that's IRMA. If there are any questions, feel free to drop those into either the chat or the Q&A function there. Now, how do we choose a coverage option, right? So we talked about Medicare Part A and B, Alpha and Bravo, Part A being the hospital component, Part B being the medical component, and they only cover 80%. And then you have a 20% figure to figure out how to supplement that, right? And so how do we choose a coverage option? And we talked about that fork in the road of supplement or Medicare Advantage. So we'll talk through what a supplement is, and we're going to do a deeper dive on this as well. A supplement is going to have a monthly premium, right? So it's going to be in addition to your Medicare Part B premium, but it usually doesn't have any copays, and I'll show you that here in a moment as well. A supplement's going to provide you with the most flexibility when it comes to providers. If you want to go to Mayo Clinic and see a specialist for GI, you can go do that if you're on a Medicare supplement. Why? Because it's covered anywhere that Medicare is accepted, because a supplement does not have a network. It is the secondary payer to primary payer Medicare. So Medicare stays primary, which means you operate on the open fee-for-service Medicare network, right? And so this means if Medicare is accepted, your supplement is accepted as well, regardless of the carrier. It does require that you carry a separate prescription drug policy. You got to have Part D coverage as well, which we'll talk about in a little while. And so that's the supplement. It's going to have a monthly premium, but it's going to have more freedom and flexibility in terms of your, choosing your doctors, or if you need referrals or things along those lines. So long as it's a Medicare accepted charge and the doctor takes Medicare, you can go there and it will be covered. Medicare Advantage, on the other hand, is going to have low or no monthly premium, but it's going to act a little more like traditional health insurance. And so with Medicare Advantage, there's a lot of people that pay $0 for their Medicare Advantage plan. And we'll do a deeper dive on this as well, but there's low or no monthly premium, as I mentioned. But with that, an insurance carrier is going to say, hey, we are the primary payer. Original Medicare is not. And so you may be restricted to a specific network with only emergency services available outside of, that network. So, that's that thing I mentioned around going to Mayo Clinic for a GI doc might not be possible if you're on a Medicare Advantage plan. They might say, hey, we've got GI doctors in network here in Evansville, right where I'm at. You need to see them, right? And referrals to specialists may be required. Medicare Advantage plans are the ones that you see commercials for on TV, right? Those are going to be the ones that Kelsey Grammer and Joe Namath and Frank Thomas and all these people that are kind of aging into Medicare at this point are putting out. And my rule of thumb is if you see an advertisement for it, it's usually a Medicare Advantage plan. Rarely are people or insurance carriers, talking often about Medicare supplements for a variety of reasons. But Medicare Advantage, you renew this every single year, etc. A little less flexibility, but lower monthly costs. And so Medicare Advantage is going to act a lot more like health insurance prior to age 65. You're still going to pay your Part B premium with both of these options. So the $202.90 or whatever IRMA applies is going to be paid with either of these options. So how do you choose a coverage option? So let's do our deep dive on Medicare supplements or Medigap plans. These were originally started in the 1960s and 70s. If we remember, Medicare as a whole started in the 1960s. It's about to celebrate it turning 65, and so Medicare is going to become Medicare eligible here soon. And as I mentioned, traditional Medicare supplements or Medigap plans, Medicare A and B are the primary payer. You choose an insurance company to be secondary. And so what that means is that you go to the doctor and you have, let's say, Looney Tunes Insurance Company for your Medicare supplement. You're going to hand them your red, white, and blue Medicare card and your Looney Tunes Medicare supplement card. They are going to charge Medicare first and the Medicare supplement second. And so it doesn't matter if they stop you at the counter and they say, well, we don't take Looney Tunes Medicare, coverages. You go, well, you do because this is a Medicare supplement. And so if the doctor accepts Medicare, they will accept the Medicare supplement. The two most common Medicare supplements currently are F and G, with G being the fastest growing. F you can't get any longer unless you were Medicare eligible prior to January 1st of 2020. And so those are becoming less and less possible for folks to enroll into unless they've worked well beyond 65. Plan G, you're only going to have to pay the Part B deductible, and it's going to cover days 21 through 100, Part B excess, 3 pints of blood, hospice, foreign travel. We're going to talk about that. It's the Cadillac coverage that you can buy right now. So here's a big chart, right? Medicare supplement options. Now, as I referenced here, you can see these in the left, far left column here. What do they cover? And then you see these green check marks. We're going to hone in specifically on Plan G, this column right here in the middle where my cursor is at. You can see lots of green check marks. And why did I mention that, hey, we probably don't need to worry about that Part A deductible? Because if we've got a Medicare supplement, all of these, aside from Plan A, Medicare Supplement Plan A, not to be confusing enough, supplements have plans that have letters, and Medicare has parts that have letters. And so a Plan A is not going to cover that Medicare Part B deductible or even the Part A deductible. It's pretty bare bones, right? Now, all of that to be said, I've never seen someone in my 10 plus years doing this enroll into a Medicare Supplement Plan A. But if we look at the Part A deductible, we go, okay, we've got coverage across the board here. And then if we look here, you can't get a Plan C and you can't get a Plan F anymore. Plan D, again, I've never seen someone that's enrolled into that. But Plan G Medicare supplement here doesn't cover the Medicare Part B deductible. And if we remember, that's an annual deductible that is $283. So as an example, if I had a Medicare supplement Plan G and I had traditional Medicare and I went to have that knee surgery, does anybody know what my costs would be if I had that knee surgery and I had a Plan G Medicare supplement and the surgery was $100,000? I don't know if somebody wants to put that in the chat or not, and I can answer it here shortly as well. But the quick answer is I'd spend $283 on that entire surgery, plus all of my physical therapy afterwards, plus anything that I needed to follow up with the doctor, if I needed to stay a night in the hospital. All I would have responsibility for if I'm paying for a Medicare Supplement Plan G and my traditional Medicare is $283. So we have people all the time that say, I want to have a knee surgery or I want to have a hip replacement or what have you, and they're before the age of 65, and we say, hey, if you can hold off until 65, your cost for that goes way down. And so as people make the transition to Medicare, usually it's welcomed, right? The network opens up and you have a lot less out-of-pocket exposure. And many times it's less expensive than a pre-65 health insurance plan. So that's important to note. A couple of things that are important to note here as well. All Medicare supplements are substantially equivalent. That's an insurance term. That means they're the same based upon the plan letter chosen. So as an example, a Plan G is a Plan G is a Plan G. It does not matter what the carrier name is. They're going to and are federally required to cover these things in this column, right? Another thing to note here, beyond all Plan Gs or any of these, Plan N is a Plan N is a Plan N. A Plan N is not a Plan G, if that's not clear. But a Plan G, or any of these, don't rely upon Medicare for foreign travel emergencies. Right? There are plan limits. If you're traveling, always get travel insurance. It's inexpensive and it's good to have in addition to your Medicare. Your Medicare might pick up a portion of it, but for anything travel related, if you're going out of the country, get travel insurance. It's cheap, less than $1 a day, worth doing there. So happy to answer any questions on Medicare supplements there. As we think about comparing Medigap plans, right? This is a view from one of our health plan analyses that we do for clients. And we're going to look at premiums and we're going to say, okay, whoa, what's the difference here? Well, as we look at this, all of these are some variant of a Medicare Supplement Plan G. Now, these two are traditional Medicare Supplement Plan Gs. This one's a high deductible Plan G. So you're going to have more out-of-pocket exposure with a high deductible Plan G, but like anything in insurance, it's a transfer of risk. So $116 a month is less than $176 a month, but you introduce a lot more potential out of pocket exposure by saving the premium there. So many times, that's why we're going to recommend a Plan G. Now, you can also see what's the rating type. Is it based upon your attained age, or is it based upon the age of the community that you are in? These are going to shake out to about the same when we look at historic rate increases and things along those lines, but it can make a difference in what your price is from the beginning. So, a Medicare supplement is not always going to stay the same rate. It will go up year over year. And as we are looking at health insurance, Medicare options, we're always looking into historic annual rate increases. What do these go up? How do they go up? Typically an insurance carrier you never have heard of is going to have a smaller population of people, and thus they're going to have a smaller pool of covered individuals to spread out rate increases over. And so you might see more spiky rate increases. Whereas a larger name in the insurance space might be able to say, hey, we've got lots and lots of covered individuals. We're going to be able to spread that out and make the increases a little more linear. So all that to be said, a Medicare supplement, though a Plan G does the exact same thing, there is a difference, right? And when you select one of these, it is important to note that you can only make, you make this decision when you transition to Medicare, and many times you're locking into this plan for the remainder of your life. So we say this is a lifetime decision that you're making, and I'll get to the question that was in the chat that was specific around switching to other supplements here in just a moment, because that is important to cover off on. But we are looking at historic rate increases. We're looking at the reputation of the carrier. How long have they been in the Medicare market? United Healthcare, largest Medicare supplement provider in the world, in the country. Obviously, Medicare is just a U.S.-based thing, but they are huge. And so they have the AARP United Healthcare supplement that they provide. Are they always the right fit? No. Sometimes they're more expensive from the jump. Others may be less costly. Another thing to watch is sometimes an insurance carrier, when you're turning 65, will provide you a really attractive turning 65 rate, and then you'll see much larger increases year over year as they look to make that up and get back to parity with the rest of the market. And so there are plays that insurance carriers have, and so it's important to know what you're doing when you're searching for one of these, and hopefully you feel a little better prepared there. I'm going to talk briefly about Medicare Part C, Medicare Advantage as well. So Medicare Advantage was created in 2006. If you remember that you can keep your doctors. Medicare Part C is also known as Medicare Advantage. What you need to know about Medicare Part C, it includes Part A and B, and you still need to pay your premium for Part B. It usually includes Part D drug coverage as well. It usually doesn't have a monthly premium, or if it does, it's lower than what a Medicare supplement might be. Deductibles and copays are set by the insurance carrier and may offer additional benefits like dental and vision coverage. You can't be double covered, so you can't say, I'm going to get a Medicare supplement and a Medicare Advantage plan and just layer them on top of each other, and we're going to be really, really well off with that. Not how it works. You can't have both. And unlike original Medicare, Medicare Advantage, so unlike a traditional Medicare and a Medicare supplement, Medicare Advantage plans utilize provider networks. And so these might look familiar to you. PPO, Preferred Provider Organization, HMO, Health Maintenance Organization. Each of these are going to have their pros and cons. You have to have referrals if you're on an HMO or an EPO. A PPO, it's not going to require referrals. You get a choice of providers. But the most important note on this page is a Medicare Advantage plan is coverage through a private health insurance company that contracts with Medicare annually to administer your Medicare benefits. So you're still going to pay your Part B premium, but the carrier you choose sets benefits, pays the claims, and administers coverage, not Medicare. So if you have a Medicare Advantage plan with Looney Tunes Insurance Company, and you take this to the office, you're not going to give them your Medicare ID card. You're going to give them your Medicare Advantage card, and they might say, hey, we don't take Looney Tunes Insurance Company. And you have to say, oh, okay. I need to find another doctor, or I need to find a new Medicare Advantage plan in the year following so I can continue to see that doctor. or I'm going to be paying out of pocket for that visit. And so it's important to note that Medicare Advantage is an individual insurance carrier that you choose that then administrates your benefit, and they become the primary payer. So that's why you see cost savings measures like networks, copays, deductibles, things along those lines that are built into that. So if there are any questions on that, feel free to let me know. Medicare Advantage, as I mentioned, it bundles everything together. And so it's going to have an out-of-pocket maximum. You're going to pay your Part B premium. You're going to have Part D coverage in many cases associated with it. And they might have different carrier or network types. So that's Medicare Advantage. And so you might see where, oh, this network's not in network with this particular carrier. So it's important to always double check those things. And so you can see you might have even lower annual financial risk, but you're going to have less flexibility with a Medicare Advantage plan in most cases. Key learning number 2, we're going to talk about Part D, how Medicare drug plans work. So here we are at the fork in the road. Medicare Advantage, as I mentioned, most are going to include Part D coverage, but traditional Medicare, you have to buy a standalone Part D plan. And so we're going to talk about Part D, that portion. So what you need to know about Medicare Part D. Part D plans, so these are also known as PDPs or prescription drug plans, are provided by private insurance carriers. Again, Part C Medicare Advantage may include that Part D coverage. In most cases, they do. But if we talk about traditional Medicare with a supplement and a drug plan, Part D plan premiums are going to vary from plan to plan. And you must have Part D coverage to avoid penalties. So what's changed recently when it comes to Medicare Part D? Well, there's a $2,100 cap for out-of-pocket costs for prescription drugs under Part D in 2026. This cap only applies to covered drugs. So what does that mean? Well, when you select a Part D prescription drug plan, you're going to input, if it's with us, you provide us with your medications, dosage, frequency, all of those things. And we're going to reference that against available plans. And we're going to say, hey, this plan makes the most sense for you because it has the lowest monthly premium and it covers your drugs at the most preferred rate. Your pharmacy is in network, etc. So with Part D coverage, you have to make certain that your pharmacy is in network, that your drugs are covered, and that it's the lowest cost. And so it really is a black and white decision in most cases. There's not very much gray to Medicare Part D. You're going to use this card when you go to the pharmacy, and you'll say, this is my Part D prescription drug coverage. And you're always looking for, is my pharmacy in network? Does it have the lowest premium and provide me with the lowest out-of-pocket costs when it comes to my covered drugs? Each Medicare prescription drug plan is going to have its own formulary. Formulary is a fancy insurance term for the big 800-page document that lists out all of the medications that are covered by a prescription drug plan. And so the rules are you must have one drug within each therapeutic category. And so a good example of this is they might say, hey, we cover levothyroxine. This is a common thyroid medication. That's the generic. We don't cover Synthroid, which is the brand name of that same medication. And some people tolerate Synthroid better than they tolerate levothyroxine. And so sometimes they say, I need to take the brand medication. And so we're going to look for a plan that has Synthroid on the formulary, not just levothyroxine. And so important to note that Medicare Part D coverage is there. There was, in 2025, a cap that was put in place. For 2026, that cap for out-of-pocket costs for drugs is $2,100. So if you have a big brand name expensive medication that sounds like it could be a European sports car, is my joke, you should plan to meet that $2,100 cap. We will break down and give you an idea of what your expected prescription drug costs are. And that can vary based upon what pharmacy you go to and if you're taking a brand or a generic, if it's covered, if it's not. But the $2,100 cap for out-of-pocket costs only applies to covered drugs on the formulary. So that's Part D. So how do you compare them? Well, we're looking at the annual financial risk, right? Here's an example of a prescription drug plan. The pharmacy is preferred in network and the medication is covered. This makes the annual financial risk $20 because it has an estimated drug cost of $20, which tells me I'm filling this monthly or I'm filling this quarterly and it's $5 a fill. And so if I fill it quarterly, it's $20 a year. Now, if I go over to this one over here, this is out of network. And so your medication is covered, but your pharmacy is out of network and it's not going to cover it at the same rate. And so we're looking for the lowest monthly premium. There are $0 prescription drug plans. We're looking for the lowest estimated drug costs and to make certain that your drugs are covered and your pharmacy is in network. So that's how we compare them. Do I need to enroll in drug coverage? Yes, you do. Even if you are someone that doesn't take any medications, pick the least expensive plan, or you could accrue late enrollment penalties if you don't enroll. You need to enroll into Medicare drug coverage unless you have a different creditable source of drug coverage. This could be TRICARE, VA coverage, or your spouse's employer plan. Your spouse must still be working. COBRA does not apply. If you catch nothing else out of this, don't ever have COBRA when you are Medicare eligible, and I can share more about that if there are questions around that. If you have a Medicare Advantage plan, make sure that it is an MAPD, not just an MA plan. MA stands for Medicare Advantage Prescription Drug. MA stands for Medicare Advantage, no prescription drug. So make sure that you have it and you have drug coverage in place, or you risk late enrollment penalties and some rules around when you can actually pick up drug coverage as well. Important timelines to consider, which leads into this Medicare enrollment periods, right? So as we think about turning 65, you have what's called this initial enrollment period. It's a 7-month window. It's the 3 months before your 65th birthday, the month of your birthday, and the 3 months after. This is the time of year where you can enroll into traditional Medicare A and B. You need to do that regardless if you go to a supplement or a Medicare Advantage plan. You can enroll into a Medicare drug plan. And if you miss this enrollment window, there's possible late enrollment penalties. And so that can apply to both Part B and Part D, where there are late enrollment penalties. We've seen some that people thought their employer plan was enough for their coverage, and turns out that it wasn't creditable according to Medicare. Don't worry, your employer is required to provide that information to you if it's not creditable. But if it's not creditable, and this we've seen examples of this, someone didn't have Part B or Part D for 10 years. And they accrued a pretty big penalty. And it's not a one-time penalty. It's a penalty that's tacked on every single month that never goes away. And so if you have questions about Medicare enrollment periods, fire them our direction. We want to help answer those. But your initial enrollment period. One thing to note about your initial enrollment period, and many times people don't understand this, is that Medicare begins the first of the month in which you turn 65. So what does that mean for you? Well, my birthday is October the 5th. And so when I turn 65, my 65th birthday, I'm going to start Medicare on October the 1st, right? So not on the 5th, not on November 1st. I start Medicare if I'm turning 65 and transitioning to Medicare. I started on the 1st of the month in which I turn 65. If your birthday is on the 1st of the month, which is not rare, but it does happen, it starts on the 1st of the month prior to. So if I was born on October 1st, my Medicare would start on September 1st. Don't worry, we cover all of that with you. We like to start the conversation about 6 months before 65 or your planned transition to Medicare. Now, here we are. I want to get to Kevin's question. Kevin, you asked a great question that said, hey, if you choose a Medicare supplement plan, is it true you can't switch to another supplemental plan without underwriting, even if your provider increases your premium? If you heard me mention when I was talking about Medicare supplements, we typically say it's a lifelong relationship that you have with that insurance carrier. And so you see this important note down here. Enrollment into a traditional Medicare supplement is typically guaranteed issue. Guaranteed issue is an insurance term, which means you can get it without any medical underwriting. They're guaranteed to give it to you. And they can't ask you any medical questions like your height or weight or your medical history or your prescription drugs that you take, etc. It's guaranteed issue for a period of time. That period is up to 6 months from your Part B start date, right? So whenever your Part B start date is, if you're turning 65 and transitioning to Medicare, it's the 1st of the month in which you turn 65. You have 6 months from that point to get a Medicare supplement with no medical underwriting. Now, there are some states that will allow you to make changes to your Medicare supplement without underwriting at different times of the year or at different anniversaries or things along those lines. But that is not the standard. Rather, that is a kind of an exception to the standard. And so it's important that you have enrollment into a traditional Medicare supplement if you're going to go that route. The other thing that I say often is you can always go to a Medicare Advantage plan. You can't always go back to a Medicare supplement. So The important thing to note here is if you're going to transition to Medicare, you can always go to a Medicare Advantage plan later in life. You can't always get a Medicare supplement because if you're outside of this 6-month window, there is potential that if you have pre-existing conditions or you take specific medications or things along those lines, that even if you've never had a Medicare supplement and you started with Medicare Advantage and you say, I think I want a Medicare supplement, well, in most cases, the carrier is going to say, no, you can't because you have this pre-existing condition or you take this medication or you're this height and weight, so we're going to rate you up. There's a period of time where they can't do any of that federally recognized. And so we want to make certain that we take advantage of the Medicare supplement enrollment within those 6 months from your Part B effective date. And so, Kevin, let me know if that answered your question, but it's a really, really good one. Could tell that it was a high priority for you since you asked it right from the beginning there. And so great questions there. Now, Medicare enrollment periods. The annual enrollment period, AEP, runs from October 15th through December the 7th. What can you do during this period of time? Well, you can change from original Medicare with a Medicare supplement to a Medicare Advantage plan, and vice versa. You could drop a Medicare Advantage plan and transition to a Medicare supplement and a drug plan. Any changes that you make during this time of year are going to begin on the first of the year. So if you made a change to your plan on October the 17th, during the open enrollment period, it will go into effect on January 1st of 2027. You can switch Medicare Advantage plans during this time of year. You can switch from a Medicare Advantage plan that doesn't offer drug coverage to one that does, and vice versa. And you could join, switch, or drop a Medicare drug plan during this time of year. So it's also important to note this time of year, October 15 through December 7, is the time of year to review your drug coverage. So we talked about your Medicare supplement, traditional Medicare and a supplement, that being a lifelong decision in many cases. For your Part D drug plan, you review that every single year because formularies change, things along those lines. Your medication needs change. It's important to review that. We make that really easy. We've got a great process this year for you all that want to review those. And so important to note, what we always say is marry your Medicare supplement, date your prescription drug plan. So marry your Medicare supplement, date your drug plan. You date your drug plan for a year at a time. You marry your Medicare supplement for the remainder of your life. And so important things there. A good rule of thumb to remember, get your enrollment period things taken care of. Just remember November is the month to do it. Right? We will be reaching out if you're already a client of ours early, much earlier than October 15th, probably late September, or early September, late August. We'll start reaching out to get appointments on the books with us to do your annual review. Further, there's a Medicare Advantage open enrollment period. If you're on an Advantage plan, you can switch it. You could drop your Advantage plan and return to original Medicare, but this only applies to folks that are on original Medicare. What you can't do, you can't switch from original Medicare to an Advantage plan. You can't join a drug plan if you're already on original Medicare, and you can't switch your drug plan if you're already on original Medicare. So important to note there. Key learning number 4, bonus learnings, and we're going to test your knowledge a little bit. So if you are someone, I know this was a turning 65 session, but if you're someone who's working past age 65, if you are continuing to work at a job with at least 20 employees, this is important to note, that provides health insurance and creditable drug coverage, you can hold off on enrolling in Medicare, but you need to defer Part B, right? So that's important. So if you're working past 65, you need to defer Part B. Sometimes that means doing nothing, but if you are receiving Social Security benefits for 3 months prior to your 65th birthday, so if you've started the Social Security spigot of dollars from your Social Security benefits, you are automatically going to be enrolled into Medicare Parts A and B. And so if you're continuing to work, here's something to note. If you're continuing to work at a large employer with more than 20 employees that provides health insurance and creditable drug coverage, and you're not taking Social Security, you don't need to do anything. You can continue on that employer plan. Some folks might pick up Medicare Part A if they would like to, which we'll talk about here in just a moment with HSAs and some impact there. But some people will pick up Medicare Part A because, again, it's typically premium free. But if you are receiving Social Security benefits prior to the age of 65, you need to take your card, and they give you the rules for it. You'll get it in the mail. You sign the back and say, I want to defer Part B. I don't want to start it yet. And you send it back to them, and you say, I don't need it right now. And so you can do that. So important to note there. If you're working past 65, be sure that you stop HSA contributions if you're contributing to one as part of your work plan, or if work's contributing to one on your behalf, 6 months before you intend to transition to Medicare, or else you risk penalties and some tax implications. And so HSAs and Medicare do not mix. Those are oil and water. And the reason we say 6 months before if you're working past 65 is that Medicare Part A can and does backdate up to 6 months. And so if you're 68 and you have just retired, and you retired at 68, your Medicare Part A might go back to 67 and a half for you. And that's the hospital portion, if you remember. So 6 months before you intend to transition to Medicare, stop any HSA contributions if you're working past 65. If you are retiring at 65 or you are making a transition to Medicare at 65, you can contribute up to the month you become Medicare eligible. So important notes there. COBRA coverage, again, if I mentioned you get nothing else from this, COBRA coverage is not considered creditable coverage according to Medicare. An important note about COBRA coverage, this is the continuation of your previous employer or your spouse's and previous employer coverage. Sounds great, right? I don't want to pick up Medicare yet. Well, a note from COBRA, if you read the documentation really closely, is this. If you are otherwise Medicare eligible, so you're 65 or older, you're Medicare eligible, and you have COBRA coverage, it actually works the opposite of Medicare A and B. Remember how I said Medicare A and B will cover 80% of your costs, you're responsible for 20%? Well, guess what? COBRA is going to flip that. If we don't have any component of Medicare, we've only got COBRA, and we are Medicare eligible, COBRA is only going to cover 20%. The 20% is what they are legally obligated to cover because they say you should have Medicare. You shouldn't be on COBRA. We're only going to cover 20%. You're going to be responsible for the other 80%. So if you are Medicare eligible and you have questions, do not take COBRA or contact us before electing it. It's important to note. Here's a little quiz for you all. Traditional Medicare and Medicare Advantage. These are two side by side. What's not pictured here? As we look at this, we go, okay, here's annual financial risk. They're almost identical, right? They're very similar in cost. Here's your total out-of-pocket risk with a Medicare Advantage plan. Here's your monthly premiums. We've got a little bit of IRMA that applies here, etc. What might not be pictured? I'll see if anybody pops into the chat. It's okay if you don't. If you don't know, that's why you're here. But if you want to take a guess, feel free to. What isn't pictured? Well, I will tell you here. What's not pictured is that traditional Medicare does not have a network. So you'll have significantly more flexibility here. A Medicare Advantage plan, though it looks a lot less costly from a monthly premium standpoint, is going to have similar annual financial risk, but the pros and cons of a lower monthly premium is that you're going to have less flexibility when you want to go see a specific doctor, things along those lines. And so important to note that you're referencing that very closely. If you want to go the Medicare Advantage plan route, we can certainly assist with that, but make certain you understand the implications and pros and cons of each option. What to check for when you're enrolling in Medicare. Provider networks if we're exploring Medicare Advantage. The drug formulary, that's that fancy list that I talked about for prescription drugs. Drug costs, right? What are my medications going to cost? If we're exploring a Medicare supplement, let's look at historic rate increases over the past 10 years or so. Let's also look at the stability of any carrier that we're selecting, whether that's Medicare Advantage. If it's a brand new name to the insurance space, we are a little more leery of that, and we like to see stability for a variety of reasons, right? We're going to verify if IRMA, not your aunt, not the hurricane, but the income-related monthly adjustment amount. We're going to make certain there are no surprises when it comes to what your Medicare premium is going to be. And then last but not least, we want to make certain that you have a clear understanding of what your out-of-pocket exposure is going to be. Is there anything else that I'm missing here that we've missed as a part of this? I always like to ask that question, things to think about. So that's what to think about and consider. So what are your next steps, right? We're talking about turning 65. Maybe you're coming up on 65. Maybe you're a little ways off and you just had some questions and you wanted to get an overview of what Medicare is, how it works, what it does do, what it doesn't do. Key things to consider. What are your next steps? Well, Your financial advisor works with us at Move Health. And so, not a sales pitch, rather, we are here to help. This costs you nothing. In fact, your advisor pays an annual fee to make our team of experts available to you. And so, the health planning analysis is going to provide you an overview of provider networks, HSA eligibility, drug coverage, things along those lines, other insights around carrier stability, drug costs, etc. And as a reminder, if you're someone who's turning 65, and you're still working, and maybe your spouse is younger, maybe they're 61, and you're saying, I guess I got to work until 69 to get my husband or wife to 65. Not the case. We can help solve the pre-65 side of it as well. And so keep that in mind for your family, for friends, as I mentioned at the beginning, your pickleball partner, whatever it is. And so hopefully you all have a much better understanding of how Medicare works, what it does do, what A, B, and D do, and how Medicare Part C is Medicare Advantage and not really a part of original Medicare, and maybe how to consider a Medicare supplement more closely. And so I'm going to stop here for just a moment and see if there are any questions that have come up. I had Kevin's question there. I'm happy to field any others. Nothing's off limits. If you want to know about what music I played, or if you want to know about Move Health or anything along those lines, or if you want to know about Medicare, most importantly, feel free to use that chat functionality, which is there at the bottom. And if nothing else, we will make certain that you get all of the information, this recording and all of those things for you. I just put a chat there. And so Daniel, no problem. Happy to help out and glad that you could join us today. And so looking forward to serving you all as you come through, and work with us through your advisor, or if we've already met, we're so grateful to have already partnered with you. And so to all of you that may maybe questions about Medicare, things along those lines, feel free to reach out to us. That is why we are here. But without further ado, that is Move Health. That is Medicare 101 about turning 65. Hopefully you feel more well prepared. I need to go put on my wetsuit. It is time for the underwater basket weaving course. And so if you are joining that, you can stay right in this Zoom room. We'll go right back to it. I'm kidding. I don't have a wetsuit. I don't teach that class. That's my wife. But no, kidding. All jokes aside, thanks everybody. Have a wonderful afternoon. We will talk to you very soon. See ya. Bye-bye.